Welcome to YouTube Live. This is case study number 3. Our goal is to present a new case every day about sciatica. We have 65 cases of sciatica, we have more, but we have 65 cases of sciatica that we're going to present one a day. And the reason we're doing this is because it's very important that you understand what you can expect from care. So patient-reported data will help you make better decisions. Providers don't have to publish data, so our goal is to be as transparent as possible. This is case study number 3 for sciatica. Patient came in, 71 years old. Every case study has information that's valuable. They're not all the same, but each one has a little bit of information that is more valuable that'll help you understand better. This particular patient, 71 years old. Back pain and leg pain. Sciatica. Before seeing us, saw 4 other doctors and had an MRI done, which is fairly consistent with patients that come into our clinic. We get a lot of patients that have tried other things before they come see us. We tend to do things a little bit differently where we have the ability to take pressure off the disc, so we tend to be everybody's last stop, although you could be the first stop. So 4 doctors had an MRI. Now before seeing us, this patient went to a physical therapist, had physical therapy, didn't get better. Went to a chiropractor, had chiropractic treatments, didn't get better. Had 3 cortisone injections directly into his spine, did not get better. Was taking narcotics and anti-inflammatories. Again, pretty typical regimen for back problems. Tried all these things, did not get better. Okay, still suffering with pain. Came in to see us after having gone through these things. We did a very specific type of MRI that helps us identify the source of the sciatica, because this is all about sciatica. We have a 9-step process to eliminate the sciatica. So he came in, did the MRI, found out he had herniated disc, degenerated disc, bulging disc, stenosis, sciatica, the pain down the leg, and spondylolisthesis, the shifting of the bone. This is about every problem you can have in your spine. So he doesn't have one problem, he's got a lot of problems. Obviously, he's had this back pain for a while because he's tried all these other things. Now, when he came in, his back pain and his sciatica was a 7 on a scale of 1 to 10. His Oswestry Disability Index was a 30. So he had some disability as a result of the pain, but he wasn't completely disabled. Oswestry Disability Index is how we score the effect of your pain on your lifestyle. How much does the pain affect your ability to live your life? That's the score. 2 very important scores when you're tracking outcomes. You need to know how much better was the pain, and you need to know how much better was the disability index. Came into our program, 9-step process, went through the program, had 20 treatments. So not a lot, okay? Some of the ones we talked about the other days, they had 30, and I think one of them had 40 or 38. 20 treatments. Back pain, leg pain, completely gone, down to a 0. Oswestry was an 18, so it's still a little bit limited with some things, but our goal is always to get them into the safe zone. Anything below 20 is what we call the safe zone. Okay? Went through the 9-step process, end of care, back pain completely gone. Now what's important here? Number 1, he was 71 years old, and he tried all these other things and did not get better. Our treatment, we don't use any drugs, and we don't use any surgery. That's what's important here. So this is case study number 3. Again, our objective, to present to you patient-reported data. Patient-reported data is more important than what I tell you. This is what the patient said happened. Pain was a 7, oswestry was a 30. That's patient-reported data. Okay, oswestry is patient-reported data. Providers do not have to publish outcomes. They do not have to publish outcomes. So the problem is, patients don't know where they should go, where they should get their treatment. Here's a good example. Okay. You tried everything and still was no better. Actually, pain 7 after all this is a lot. Okay? Because providers do not have to publish data, you don't know what's best for you. Our goal is transparency. Our goal is for you to understand what you need to do to solve your problem. Or more importantly, that there are options for you. It's not uncommon. Patients are suffering every day. Back pain, leg pain, every day. And they're not getting better because they don't know. We're here to help you. Our goal is so everybody knows. Patients don't know because providers are not obligated to publish. The solution is publish. Give you information. We have a scientific study that was published in a scientific journal comparing our outcomes to everybody else's outcomes, the outcomes that we can actually find of other people, because they don't have to publish them. So our goal is to help you make better decisions. And the way you do that is have clear metrics, clear objectives. Know what the outcomes are. Okay, we have 500 cases. We're going to present 65 sciatica cases over the next 3 months. So tomorrow we'll do case study number 4, and I think we're going to do it earlier in the day, because everybody said do it earlier. Thank you very much. If you have any questions, you can fill it in for the comments. Thank you. Have a good day.